fellow faculty members, and the workshop participants. First of all, I wish to thank Dr. Singhal sir and the organizers of the North Zone ISA conference for giving me a chance to speak in this workshop. Also, I want to thank the workshop coordinator, Dr. Monica, to enable me to present virtually. The topic given to me today is teamwork and managerial skills. I believe I was chosen for this topic largely because of my military background. In the military, we work on a buddy system, but an interesting point is that your buddies are never the same throughout your service. The military trains you to function effectively as a team in an ever changing environment with different people, different roles, and different pressures. We constantly remind ourselves while practicing drills that the more we will sweat in peace, the less we will bleed in war. It is the same for all of us here. Our nurses change, surgeons change, residents change, situations change. But what remains constant is teamwork and managerial skills, and to be ever ready for crisis management scenarios. Before we go further, I'd like to briefly outline what we'll cover today. By the end of this session, we should be able to define teamwork and understand why it is so important. We look at the key elements of effective teamwork, recognize the barriers we commonly face, and discuss practical solutions. I'll also touch upon a few essential managerial skills that help teams function better, and most importantly, how we can apply all of this in our healthcare workplace. Teamwork is defined as a collaborative effort of a group to achieve a common goal. For us, it is a shared responsibility towards a common outcome, patient safety. It involves pooling together diverse skills, knowledge, and perspectives to achieve greater outcomes than possible individually. Effective teamwork it fosters communication, trust, and synergy, enhancing productivity and innovation while promoting a sense of belonging and mutual support amongst team members. There was much public reaction when in 1999 the Institute of Medicine published a landmark report titled To Err is Human. This report revealed that nearly 100,000 people died in a single year in US due to preventable human errors in healthcare. Importantly, about 72% of these errors were related to communication failures, not lack of knowledge, not lack of skill. Over the years, we have realized that this number was likely underestimated. Human errors continue to be the third leading cause of death worldwide. Now, what does the Joint Commission data tell us? Root cause analysis of sentinel events over the years show that nearly 78% of adverse events arise from human factors, communication breakdowns, and leadership issues. This has remained constant in healthcare over the years. In other words, most patient harm is preventable if teams function well and team roles are managed effectively. This is why teamwork and managerial skills are not optional in healthcare. They are central to patient safety. Aviation operates on a zero error philosophy, but this always wasn't the same. Army aviation crew coordination failures in mid 80s contributed to 147 aviation fatalities and cost more than $290 million. Dollars. The vast majority involved highly experienced aviators. Failures were attributed largely to crew communication, workload management, and task prioritization. After working on multi team trainings, the US Navy and Air Force universally deployed team coordination training in the form of CRM, that is, Crew Resource Management, in 1998, resulting in a steady decline in human factors based mishaps. If aviation had continued similar to what is reported in healthcare, even now, it would amount to two jumbo jets crashing and 680 patients dying every day. Would anyone then even consider boarding an aeroplane? Yet, this is what is happening in healthcare. That same team mindset, handovers, checklists, closed loop communication, shared responsibility, and looking out for each other has been introduced in healthcare. Especially anesthesia and OT teams are modeled on the airline industry. This is what is keeping our patients safe and drastically reduces human error, and we need more of this. Now, let's look at what actually prevents teams from performing. at their best. Hierarchy and fear stop junior team members from speaking up. They worry about being wrong, provoking defensiveness. Role ambiguity and lack of coordination create confusion about responsibilities. Communication breakdowns, misinterpretation of cues, assumptions, and varying communication styles can all derail a team. Distractions and conventional thinking, like tunnel vision or over reliance on experience, also reduce effectiveness. Finally, when a team's strengths and weaknesses are not recognized, talent is underutilized and potential solutions are missed. None of these barriers are rare and none are unsolvable. They require intentional leadership and managerial skills. Now, let's look at these two aviation cases that illustrate this perfectly. The first is the San Francisco flight incident. There were three pilots on board. During landing, the senior pilot initiated early descent, which would cause the plane to land short of the runway. The other two pilots noticed the danger, but respect for hierarchy prevented them from challenging the senior pilot. Tragically, all passengers and crew were lost. This was not a lack of technical skill, but a failure of teamwork and communication under hierarchical pressure. Now, contrast this with the flight which landed on the Hudson River. Here, the pilots had never flown together before. Yet, they communicated immediately, coordinated their actions, and made critical decisions as a team. The result, all passengers and crew survived safely. The difference was not experience, it was effective teamwork, communication, and shared responsibility. The same lessons apply to healthcare. We may have individually brilliant clinicians, but without team based training, patient safety can get compromised. The Institute of Medicine, in their book on healthcare education, A Bridge to Quality, highlighted a critical gap in healthcare education. They brought out that once in practice, healthcare professionals are asked to work in interdisciplinary teams, yet they are not educated or trained in team based skills. We need our team of experts, but what we need more are our expert teams. As part of the Patient Safety Foundation, a tool called TeamSTEPPS got introduced and got implemented in many hospitals by 2013. This is something I would like you all to take back from the workshop today. This is a tool we have personally tested and then implemented in our OT, anesthesia, and adult critical care department to align and strengthen our teams with the aim of improving patient and employee safety. The framework is called TeamSTEPPS. It provides structured tools to reduce errors and improve patient outcomes with practical, actionable steps to develop teamwork around the patient. TeamSTEPPS is team strategies and tools to enhance performance and patient safety. It was developed by the U.S. Department of Defense in collaboration with the Agency for Healthcare Research and Quality. Its goal is to improve teamwork, communication, and patient safety in high risk environments. Since its creation, TeamSTEPPS has been adopted in hospitals across the US and globally, helping teams work more effectively under pressure. The first step in implementing a teamwork system is team development. Fundamentals such as team size, membership, and leadership identification and distributions. Patients and their family caregivers are part of the care team. So, what distinguishes a high performing team from one that struggles? First, a clear purpose and shared goals. Every team member must understand what they are working towards so actions are aligned. Second, trust and psychological safety. Team members need to feel safe to speak up, admit mistakes, and challenge assumptions. Third, effective communication. Structured debriefings, briefings, and open dialogue prevent misunderstandings and errors. Fourth, defined roles and accountability. When responsibilities are clear, we reduce duplication, gaps, and errors. Finally, actively participate in collaboration, adaptability, and continuous learning. High performing teams are resilient. They learn from successes and failures alike and adjust. The team steps framework and competencies. Basically, there are four skill sets which the team steps intends to build. The first is leadership, that is, guiding the team, setting priorities, situation monitoring, staying aware of changes in the environment and patient status, mutual support, helping each other, speaking up when needed, communication, which should be structured, closed loop, concise information exchange. The Team Steps framework reflects the connections between these four core skills and how they contribute to highly reliable, safe, and effective care for every patient. The arrows depict the two-way dynamic interplay between the four skills and the team-related outcomes, which is the basis of a team striving to deliver safe quality care and support quality improvement. Knowledge, which is based on a shared mental model. Attitudes, which are based on mutual trust and team orientation. Performance, which reflects more of adaptability, accuracy, productivity. Efficiency, safety, and high reliability. And the fourth element, sustainability. The Team Steps was introduced in hospitals in 2013. And in 2024, a fourth outcome, sustainability, got added with good team behaviors changing into habits, changing the structure of team steps from the triangle to a circle. It is a reflection of enduring culture of safety. Now, why team steps? The cost of implementing team steps is minimal compared to the savings surrounding outcomes and the satisfaction. Many studies have found that teamwork training can lead to stronger culture of safety through positive changes in behavior, increased patient satisfaction, enhanced staff satisfaction, improvement in outcomes, cost savings, and process efficiencies. Now, multiple tools and strategies are delineated by the team steps for each of the four skill sets, some of which are very familiar to us, like the closed loop communication, S bar, call out, briefs, handovers. Others we need to imbibe. We can build team competencies on them, starting with basic 100 level to advanced 300 level skills. But due to lack of time, it will not be possible to speak on these in detail today. In future, if we can have a full 2-day workshop on team steps where we can practice and role play these tools and strategies, then we would be able to master them individually. The other subtopic that I wanted to address was managerial team skills. Now, let us look at it as a framework on how to manage a team. I'm sure we are all familiar with the concept of direct the rider, motivate the elephant, and shape the path. The core idea here is that effective managers align the logic, rider, with emotion, which is the elephant, and environment, which is the path. Managers must give clear direction and reduce ambiguity. The key managerial actions to direct the team member leader would be clear vision, define where we are going, explain why it matters, break goals into specific actionable steps, identify critical priorities, assign roles which are based on strengths, and align expectations and metrics. They can use tools like SMART goals, visual dashboards, clear SOPs, and workflows, regular feedback and alignment meetings. Because when the rider knows the destination, the team moves faster and smarter. The next is motivate the elephant. Managers must connect with his team with emotions, not just logic. Find the feeling, create a sense of purpose, tap into the team member's emotion. Direct by storytelling instead of giving instructions. Share the success stories from any pilot work published or known, or some new team member who has brought in some experience from his old team which worked very well. Build psychological safety and trust. The second is shrink the change. Role model behavior that you would like team members to imbibe. Break things down into smaller changes so that the team is not overwhelmed. Use templates as handoff tools and celebrate the small wins. And lastly, grow your people. Create a sense of team identity and foster a growth mindset. Build belonging and pride. Improvement should be about finding what needs improvement in process rather than blaming members of the team. Recognize the efforts and achievements. Reward by appreciation in debriefs. For example, if somebody reminded you just in time of an antibiotic allergy, remember to thank this person. Say, thank you so much. Your intervention today saved a life. A motivated elephant can move mountains even when the rider is unsure. Shape the paths. Managers must design systems that make the right behavior easy. Tweak the environment by simplifying processes and remove obstacles. Clear protocols and SOPs should be handed over to the team. Changes which make it easier or better. Revise the templates to streamline. Place them in visual spots as a reminder and tweak time for briefs so that all can attend. Build habits. Start small and build. Establish action triggers to keep self and team on track and accountable. Efficient communication channels, well defined roles, and escalation pathways. Audit the templates for significant information. Leadership culture is important. Rally the herd by sharing early successes and leveraging peer gains to help drive change. Informal and formal leadership shares and a continuous improvement mindset. Don't just change people, change the path they walk on. Even the best teams fail in a poorly designed system. Great managers succeed not by pushing harder, but by aligning the rider by strategy and clarity, elephant by motivation and culture, and the path by improving the systems and easing the path. To lead the change, managers must think clearly, feel deeply, and design wisely. This brings us to the last slide of this presentation. The key takeaways for you when you return to work from the conference. Assess your current organizational culture and existing patient safety program components. Design and implement initiatives to improve team related competencies amongst your staff. The AHA Team Steps Pocket Guide is easy to download from the AHA Team Training website. Try to integrate at least some tools from the Team Steps into your daily practice. Dr. Monica will now take this forward for the fun part, team skills game, which follows. And I thank you for being such a wonderful audience.